Initially, patients were told to remain on their immunosuppressants. IBD patients were told to remain on them. Is that advice still in place? Is there any concern about IBD patients on certain drugs, whether or not they should continue taking their medication? What is the current guidance on that?
Yeah, so our SECURE-IBD data supports the current guidelines that if patients are stably on a biologic medication, a TNF antagonist medication, then the current recommendation is to continue on that medication. Although I think it's important to take it on a case-by-case basis, because in some situations, if a patient has contracted COVID, then their doctor may recommend delaying the dose of that medication, at least until symptoms have resolved. And our data also support the current guidelines regarding corticosteroids to use steroid-sparing treatments when possible, or avoid steroids when possible. Because as I mentioned earlier, there is a finding of more severe COVID outcomes in association with corticosteroids. But there again, these recommendations need to be considered in the context of the individual patient, and sometimes the benefits of treating an IBD exacerbation with steroids outweigh the risk of giving steroids in the setting of this pandemic. There are numerous other questions that I think further research is needed in order to more definitively answer. And those are questions such as, if you have a patient in long-term stable remission on an anti-TNF medicine plus an immunomodulator, in this current pandemic, would you consider de-escalating them to just the anti-TNF, removing the immunomodulator? And I think that we need more data to better answer.
How challenging has it been with a novel virus to kind of make these decisions on who should remain on what, as we're kind of learning more and more about this virus, as the months go on?
Yeah, it has been incredibly challenging. And I think GI docs around the world have sort of stepped up to the plate to try to collect research and data as quickly as possible in order to provide some guidance. And that's where things like the RAND panel that David Rubin led came into play, where before we had time to do trials, they conducted a consensus survey of many gastroenterologists to understand better, well, what do you think is the appropriateness of this intervention, or of continuing this medication, or of stopping this medication? So then when we don't have the evidence base, we can at least get a sense of what is the expert opinion right now. And the level of collaboration with the international community in contributing cases to the SECURE-IBD registry has been pretty amazing, because that has allowed us to gather really rapid data and help to guide some of these decisions. But it's still such a moving target, and it has been very challenging, both in my personal practice and then I think for the greater GI community.
Okay. And you spoke about the SECURE-IBD program. Can you kind of explain the registry and how it's impacting research in COVID-19 and gastro?
Sure. So the overall goal of the registry is to evaluate COVID-19 outcomes in pediatric and adult IBD patients around the world. So the way it works is we have established a secure server, and we created a survey where healthcare providers, if they take care of a patient with IBD who contracts COVID, can go onto our website and enter this survey that goes into our secure database and answer de-identified information about their patient, what medicines the patient is on, what risk factors they have, what are their demographic characteristics, and then also what outcomes did they experience. And then we have been able to analyze this data to get a sense of what are the risk factors for more severe outcomes.